So without further ado, I do want to welcome Dr. Ramasamy. So join me in welcoming him.
Thank you, Dr. Phil. We are practicing on golf course in Rancho. I just want to give a brief introduction about how sleep evolved as a science, particularly a medical science. American Board of Medical Specialties established in 1930s, and sleep did not get a recognition as a specialty until 2007. So it's very late compared to other specialties. Sleep was not recognized as a health issue until 30 or 40 years ago, and then a lot of research started happening. Still, the scientists were debating what actually sleep does. Everybody knows that when they did not get a good sleep, they are tired or not able to focus, but they did not know what are the steps involved, why it is affecting the focus or the tiredness. One of the pioneers of sleep medicine is Dr. William Dement, and he wrote a book, Promise of Sleep, and where he mentions healthful sleep is much more important than diet, exercise, or heredity for the longevity. So what does sleep do? Sleep helps to repair the brain and the body during sleep. There are amyloid, which is a building block of Alzheimer's dementia. Those things get cleared during sleep. Growth hormone is secreted more during sleep, which helps to repair the body and heal. And dreams, they are very, very important for the learning and memory to consolidate your thoughts. And also immune response gets better. Pain reduction happens with sleep. One of the ways we can understand how a particular organ or a particular function is important to health is by taking away that function, or when that function goes dysregulated. One of the very important topics in sleep is sleep apnea. And when somebody has a sleep apnea, there are so many dangerous consequences like heart attack, stroke, or memory problems, impairment of glucose control in diabetics, or accidents. And a lot of more information about obesity is a two-way street with sleep. So in the beginning, obesity causes sleep apnea, but in return, sleep apnea can also provoke obesity. I will explain later. So what does sleep do for anybody? So they can actually show their real face to work rather than like a mask. And sleep actually helps to sparkle the brain. So Einstein said, imagination is the future and knowledge is the past. And the imagination and dream are very much linked to each other. So when you have strong imagination on a subject, it comes in your dream and back and forth. So this is one of the presidents of India. He passed a few weeks ago, and he is a nuclear scientist and astrophysicist as well. So this is how he was motivating the people. You have to have a dream before even the dream can come true. And he is saying the same thing. Dreams transform into thoughts and thoughts into action. But this is not a one-way street. It is going back and forth. Memory is a very dynamic, fluid process. It is not just a mere reflection of what actually happened. It's keep getting reinforced and refined with the new experiences and the past experiences. It is being combined or being associated. So what does actually happen when we sleep? Sleep is not like we are turning the computer down or computer is being turned off. It is brain is going into a different mode. It is not being shut down. So what are the things that is important for the sleep? Are the quantity, quality, timing. If somebody has a good sleep, all these things, they don't have sleep inertia. What sleep inertia means, at any particular given time, how much somebody is so much desiring to have a sleep or feeling tired. How does sleep help? It consolidates and enhances memory. What is consolidation of memory? It is like a defragmentation of computer. Most of you guys may know what is a defragmentation. For some people who may not know, I can just give a brief introduction. It is like hard drive. Memories are stored in so many different places, but when you look at the property of hard drive, how much space is left, it is very little. You can defragment the computer, and you still have the same memories, but more space is opened up. So what actually happens is the memory encoded programs are being consolidated, grouped together. So that is what one of the things sleep helps. And it also finds patterns that we never thought it is existing. This is one of the important slides for memory and memory enhancement from short-term to long-term. That is everybody's goal, to be the expert in a particular field. So that is exactly what sleep does. Hippocampus can be compared to a memory management unit in a computer. So short-term memory, long-term memory, both are stored in cortex. That is the top layer of the brain. In the beginning, hippocampus takes every piece of our experience and encodes it and stores in the cortex. When it is a short term, you still need hippocampus again to retrieve that information. But when you keep reinforcing with practice and sleep, then what hippocampus does is, this is another model. So in the beginning, it is moving from the hippocampus to cortex, and later on, it keeps reinforcing, and when it becomes consolidated, long term, the hippocampus is not needed anymore to retrieve the memory. So that is why, like people with dementia, they may not be able to retrieve what they did yesterday, what they ate for the breakfast. But if you ask them old events 20 years ago, they may be able to do it, because the hippocampus is the first part to get affected in dementia. So when the hippocampus memory management is out, then they cannot retrieve or register anything recent. But they can still, until the late part, when the cortex goes out, they are able to retrieve the information which are old memories. Memory consolidation is another thing. What happens is, when it is a long-term memory, genes are expressed, and new proteins are synthesized, and synaptic connections are made. That is what happens in a long-term memory. So this has been very lively proved in an animal model. So next slide would be a good 5-minute video for people to watch.
But we actually know very little about what sleep is doing for the brain.
Sleep is an enigma. What is its purpose? That's something that we do not understand.
For a long time now, sleep researchers have been debating a possible connection between sleep and memory. But exactly how could sleep enhance your memory? We don't know. Possible clues have been showing up in the dreams of rats.
But in 3 dimensions,
Yeah,
actually.
yeah.
MIT researcher Matt Wilson says he can read rats' minds, including their dreams, with tiny electric probes.
What it means is that we're able to, at any time, plug in our electronics and
Figure out what they're thinking.
read their mind.
Wilson's mind readers are actually thin wires, about 1/10 the width of a human hair, that pick up the electrical signals among dozens of brain cells. The wires, painlessly implanted in the rat's brain and held there by a kind of hat, carry the signals right into Wilson's computers.
That information comes up back through these connectors into your computer, and you're sitting there watching a map of the thoughts of this rat.
Exactly. That's exactly right.
It's remarkable.
Wilson is most interested in mapping the rat's thoughts in a part of the brain called the hippocampus. The hippocampus of a rat, or a human, plays an important role in memory, including our sense of space and location. Wilson uses a specially designed rat maze. If the rat follows the right route, he's rewarded with some chocolate syrup. And as he moves through each different spot in the maze in search of his goal, a unique pattern of cells fires in his brain.
So we can tell where the animal is simply based upon which cells in the hippocampus are active. That pattern will be unique for a given location in a given environment.
What's amazing is that the same patterns turn up again, even after the rat drifts off to sleep. That's right, Wilson eavesdrops on the rat's dreams. And they aren't about cheese. They're about running the maze.
So when the animals would go to sleep, we would see these patterns of brain activity that were expressed while the animals were running on the maze being replayed in the same sequence, the same order in which they had been experienced.
But the replay wasn't exactly the same as when the rat ran the maze. Sometimes it was like an extreme fast forward, quick flashes of the experience.
Now, at the time, you never know what is going to be important and what is not important. So you may reevaluate or edit those memories to identify the things that were important.
And this fragmented replay wasn't just happening in the hippocampus. Wilson also detected it in the visual cortex, meaning the rats were likely seeing the maze in their sleep. What's more, the visual cortex is part of the larger neocortex, which, in humans, is responsible for, among other things, long-term memory.
What are rats and what are people doing during sleep? They are processing memory. They are replaying memory. Now we could ask, is this about learning? And I believe that's exactly what it is about, that animals are, and humans are trying to learn from past experience.
So could it be that sleeping on it isn't just an old saying, but a biological process that consolidates and organizes important information?
These are pretty big concepts, and they certainly are controversial. The function of sleep as it relates to learning and memory, that's something that at this point remains speculation.
If the speculation turns out to be true, then you'd have to wonder, what is our 24/7 culture doing to our ability to think straight?
My sense is that disruption of sleep is much deeper than simply, robbing us of rest. My guess would be that we lose the opportunity to gain understanding, a deep understanding of our past experience, that what we sacrifice, in a sense, is wisdom.
Homeostasis is a function in physiology or medicine. What it means is number of things our body regulates. When it is a plus, too much plus, it changes to bring it to equilibrium, like a blood pressure, body temperature, food or energy. Sleep is very much in homeostatic control. When you don't have enough sleep, your body looks to sleep, or your brain looks to sleep. And energy, food intake is very much linked to sleep. The hypothalamus, which is one of the homeostatic control area, the energy control and sleep control areas are very close. And the two hormones, they are secreted in the periphery called leptin and ghrelin, are very much linked to sleep. So when sleep is not having good quality and quantity, those energy controlling hormones, leptin and ghrelin, go out of whack. So it is very much proved these days, like people with obesity have these hormones not in control, and it puts person at high risk for sleep apnea. But when somebody has a sleep apnea, again, the controlled balance of these two hormones are not in equilibrium, and that puts the person to consume more. So if somebody is well slept and no sleep apnea, they are not looking for junk food. But when somebody is not having good sleep, they want to eat more. And that puts somebody at a high risk for obesity. And these are the studies, like people who slept less than 5 hours per night gained 2.5 pounds compared to people who are sleeping 7 hours or more per night. So relative risk of obesity, and it is a very large study. And what does sleep do for the mind or for the emotion control? This is one of the leading authors of mood and sleep, Rosalind Cartwright. She wrote called the 24-hour mind. Yes, not just the heart is working 24 hours, the mind works 24 hours as well. When people's dreams are affected, they are more prone to get depression, and the vice versa is true. People with depression, they don't get good dreams. The study of dreams are like practically waking up the patient so many times during their REM sleep and ask what they dreamt few minutes before. People with depression, they could not recall the dream. They may not even have the dreams. So this is what I said before. Memory is never a duplication of the original event. It is a continuing act of creation. Dreams are products of that creation, and they are not only helpful for memory and learning, they are also controlling the mood, regulate the mood and emotions. REM sleep, I will tell a little bit later what are all the little differences between REM sleep and non-REM sleep. REM sleep is supposed to start about 90 minutes after anybody falling into sleep. For people with depression, it starts very early, 30 minutes or 20 minutes. So what actually happens is then people do not get enough deep sleep, non-REM sleep. So the deep sleep is the time when growth hormones are secreted. The body is getting time to heal the damages and repair and have some growth. As far as the body, as far as the brain, that is when it is clearing a lot of the bad proteins being secreted during the daytime when the brain is continuingly awake for long hours. Insomnia and depression. So they are very close to each other. If somebody has trouble sleeping, insomnia, yes. But if it is due to some crisis in life, stressful event, if it goes on for a few weeks, maximum 3 months, more likely we can say just only insomnia. But when it goes beyond 3 months, insomnia coming for day and every day for months and years, more likely it is a depression. And the scientific community is still hesitating to say insomnia is a cause for the depression. That is what this article is talking about. So what are the parts of the brain that is involved in sleep? The lower part of the brain is called brain stem. That is, in general, associated with primitive life events like breathing, blood pressure control, eating, chewing, all those things. So that is the brain stem area. And the area above is more like a nucleuses, like amygdala, hippocampus, hypothalamus. So this area is always sending signal. Brainstem is always sending signal to be awake. The later parts of the brain, from the top up, everything is more in evolution at a later point. Like if you look at very primitive organisms, they have more brainstem, but they don't have cortex. Cortex is where more executive, higher functions are stored and operated. So as a primitive thing, organisms want to be staying awake. So sleep is a luxury that we have to learn how to control and maintain if we are not already having it. How the science has come up now is like a flip-flop switch for sleep. So like when the wake circuits are active, sleep is not there. When the sleep starts, the wake circuits go completely off. And there are some behaviors and exposure to light and medications and exercise. They have a very significant role in stabilizing the circuits. Orexin is one of the brain chemical very much linked to staying awake, and orexin deficiency is the one causing narcolepsy. So basically there are two drives. One is circadian drive and homeostatic drive. For us to have a good sleep, we may rather bring those two drives in synchrony. Homeostatic drive, what homeostatic drive means is how long somebody is staying awake. The longer somebody is staying awake, the higher the desire to go to sleep. Okay, sleep control, that is what I was talking about, two processes. One is the homeostatic, it is called S. Process C is the circadian. Circadian is more like when it is dark. Our body, through the evolution, wants to go to sleep when it is dark. So the best time is about 11. We naturally have the circadian wave to sleep. And it alerts us around 7. So 11 to 7 is a very good time to fall asleep as per the circadian rhythm. And melatonin helps. When the darkness becomes, our body starts to secrete melatonin. That is why it is important not to look at soft screens like a computer screen, tablet, or phone during bedtime, because the brain starts to perceive that light is equal to daylight. It is getting alerted, it has to stay up, get awakened. Just a brief introduction of how sleep looks like in a neurophysiology, like how it is looking. So when we are awake, the EEG is called beta rhythm. And when we are awake but we closed our eyes, calm ourselves, that is alpha rhythm. Basically, from awake to light sleep to deep sleep, the frequency gets slower, the amplitude becomes bigger. And REM sleep, that is the non-REM sleep, but the REM sleep is kind of a mix. It looks more like alpha rhythm, but there are more eye activities too during the REM sleep. Rapid eye movement, that is why it is called REM sleep. And the dreams are so vivid in REM sleep. There are some dreams happen in non-REM sleep as well. In the non-REM sleep, there are particularly two stages. One is light sleep and the other is deep sleep. So when we enter into sleep, these are I'll just go back to when we enter into sleep, how the cycle goes around. But if you look at the chemicals involved, during wakefulness and REM sleep, pretty much acetylcholine is same. So it's kind of, REM sleep is kind of mixture. So this is the area, ventrolateral preoptic nucleus in the hypothalamus, where the non-REM sleep originates. But in case of REM sleep, there is no particular origination point. But if we have some disruption in the brainstem areas, that can take away the REM sleep. One of the important things in REM sleep, when we are awake, the prefrontal lobe here is very active, and that is keeping us inhibited, thinking what is moral, what is logical, do I have to say something, judgment. So those things are very active in the REM sleep, they become less active, letting you to have various combinations of dreams. And people with depression, that area is still overly active during the REM sleep. So this is how the sleep cycles through. When we are awake, and then we go to stage 1 sleep, and stage 2, 3, and then we will have deep sleep. 3 and 4 now is called both of them as a deep sleep. And then once we have the deep sleep, about 90 minutes, we start to have the REM sleep. And that may last about 15 to 20 minutes. But as the night progresses, we have more long-lasting REMs. So in the second half of the night is more vivid dreams. So we need to have sleep. Don't cut your sleep short, like 5 or 6 hours. Try to sleep 7 or 8 hours. The recommendation is 7 to 9 hours per adults. So what does happen in sleep? Synapses are forged and scaled. There are many new synapses happen. All of them are trying to feed the information, but not every synapse is strong enough. So sleep challenges or tests which synapses are really good. So it enhances those synapses and prunes extra synapses and clears the proteins made, like amyloid beta, which is being the founding block of Alzheimer's disease. So as we talked, not only amyloid, more extra dirty proteins which are made with our long waking hours, they are getting cleared with the sleep. So that is a new discovery recently. So we can see these are the two functional MRI pictures. One is, this side is the wake, where the CSF flow is not that much. When it is the sleep, we can see how much more CSF flow clearing out the debris of being awake for a long time. Poor sleep quality is also associated with increased cortical atrophy. That is part of the dementia, and this slide highlights which areas are getting the burden more. Can getting a good sleep reduce the risk of Alzheimer's disease? Yes, this is a very latest publication. It is possible, new study this year. So we can have a comparison here. This is more brain with Alzheimer's disease, more active colors with Alzheimer's protein accumulating, and people with Alzheimer's disease, they don't get much deep sleep waves. But here with a healthy brain, they continue to have deep sleep, and the amyloid beta is reduced in the healthy brain with a deep sleep. So beta amyloid, it is not very clear at this point whether it is a cause or effect. But one thing is clear, what is that is, NREM slow wave sleep reduces the amyloid, or beta amyloid disrupts slow wave sleep, and it also interferes with hippocampus related memory consolidation. One of the important diseases of sleep is sleep apnea. So sleep apnea induced hypoxia is related to cognitive decline, and treating the sleep apnea helps people to recover that cognitive decline. Sleep apnea manifests, or sleep deprivation manifests in children as hyperactivity, ADHD, or fidgety. When we are adult, when we are sleepy, we nod our head, doze off. But children, they don't realize that. They want to counter the sleepiness. So they don't doze off or nod the head, but rather they jump around. So 25% of the ADHD in children are misdiagnosed. So every children being diagnosed should have a sleep study to rule out there is no sleep apnea. And the driving drowsy is equal to driving drunk. There was a national news a couple days ago, the driver who hit Tracy Morgan the comedian, he was driving more than 22 hours non-stop or not having any sleep. He was driving from Georgia for almost 10 to 12 hours to pick up his truck. So he was already driving 8 to 10 hours before he started his duty. Another thing is epsilon 4, ApoE epsilon 4. Epsilon 4 is associated with increased risk of cardiovascular disease and Alzheimer's dementia. And that gets better if you have a good breathing during sleep. People with sleep apnea, they tend to have more risk factor, ApoE, rather than the protective ApoE2. Sleep apnea has been linked to brainstem strokes. So how to get more sleep? So manage your stress. Meditation is a very good thing to do. Schedule your exercise carefully, not very close to bedtime, at least 2 to 3 hours before the bedtime. And we talked about the bright soft lights. They trick your brain saying that it is awake time. And the alcohol, a lot of people use alcohol thinking that it helps sleep. It may increase the light sleep, but it reduces the very important REM sleep and also deep sleep. Caffeine, nicotine, those things better be, if particularly somebody has insomnia problem, they rather not touch it for at least 6 hours before bedtime. And also drugs. So this is how much sleep is recommended by National Sleep Foundation for the age range. How do we measure sleep in sleep laboratory? I just wanted to show few slides. So we do EEG that shows us if somebody is sleeping or not. So that is another caveat with the home sleep studies these days, because in the home sleep studies, people do not get the EEG, they just only get chest belt and abdomen belt and breathing sensor. So if somebody is keep thinking during the night, voluntarily people not breathe when they are thinking. So it could be 10 seconds, they may be not thinking, that could be falsely coming out in the result as patient had a apnea. Those things may not be real apneas. So having the full sleep study in the lab where the facility is there to monitor the brain waves, we can be sure if what is coming out in home sleep study as a apnea, if it is real or not, because we know with the brain waves comparison if the person is really asleep or if they are awake and they are thinking and they are holding the breath. So this is how the preparation looks before somebody gets on the bed and go to sleep. And these are the samples of how the sleep study polysomnogram looked like for us. It is from our lab. So you can see this could be considered as a slow waves, but the slow waves are not that much, maybe like less than 5% here, another 2%, 2%. So we need at least more than 20% slow waves to call deep sleep. So the next slide, we can see a lot more slow waves happening. So the previous slide was light sleep, NREM, non-REM sleep. This one is deep sleep, NREM. And this is REM sleep. You guys can see eye movements, how much rapid eye movements are happening on the top. And this EEG is more like kind of a mixture of alpha rhythms, asynchronous. So just to have a comparison how the eye movements during non-REM sleep. All right, so I am done. If I have a chance to
I think would be with adequate sleep or restorative sleep, effective sleep, I'm able to then cognitively do some of the same things with less capacity while using less capacity, basically freeing up more room.
Right, exactly the same thing. Like when you, say for example, when you go to a new place, when you are driving to a new place, then when you sleep, then your brain replays the same thing, or when you learn something, motor skill, piano, whatever you learn, that is being replayed, or if you learn a game, that is being replayed. And that helps you to learn quickly.
A lot
So,
of groups at Senthil Labs, one of the things we're famous for is the simulations that we're able to do because of our high performance computing and some other things. It's almost simulations.
right. So it's memory is an ongoing creative process, so it helps to create the memory better.
On one of your later slides, you had charts for a sleep study, and you had some boxes in some areas like obstructive sleep apnea for duration, number of seconds,
Mm-hmm.
or desaturation, or leg movement. I couldn't tell from looking at the charts what was defining that period of obstructive sleep apnea.
Okay. It's 10 seconds is considered to be the period for any respiratory event. So this is a 30-second window. So from here to here, it is 30 seconds. So in the beginning part, this is a sensor in front of the nose and the mouth, so they go flat. So that is more characteristic of apnea. And then later, if you compare to this amplitude of the airflow in front of the nose, it is reduced. That is kind of, we call hypopnea. So this is from here to here, it says 18 seconds. And if you look at the oxygen saturation, 92, 91, after this event happened for 18 seconds, the oxygen desaturation going to 88 and it reaches even 83.
What is the track behind the obstructive sleep apnea? What's the quantity measured there?
It's the breathing. Right. So breathing is measured in front of the nose, how the air flows, and the movement of the bells over the chest and abdomen. So if the chest and abdomen keep moving, that means the ongoing effort to breathe is there, but there is no airflow at the level of nose or mouth. That indicates there is an obstruction.
Any questions?
Yeah.
Just repeat the question.
Yes, yes. Go ahead. You may not need to work. Okay, I'm sorry. He is asking, he is waking up in the middle of the night and he is thinking about things, how to stop thinking it. I just want to explain how sleep evolved before the modern light came around. Human beings slept in two phases. So they go to sleep, they might slept like 4 hours or 3 hours, and they would wake up in the middle of the night and they would take care of the chores and they would go back to sleep. So waking up in the middle of the night is not abnormal. That is how we evolved. We wanted to make the sleep more consolidated, to be all at once. So unless your sleep drive is too much, you haven't slept for all 24 hours, then you may not even wake up once. Or if you have a high mental performance, then you may not even wake up in the middle of the night. But waking up in the middle of the night or using the bathroom a couple times a night is quite normal. And if you are able to sleep, say for example within half an hour, it's okay. So try to calm your mind and try to go back to sleep. And you don't need to work too hard to block the thoughts at that point. The other way is like if you write down, if you have a bedtime routine, like say for example, avoid at least 1 to 2 hours any bright light or the other good sleep practices, follow the good sleep practices, and write it down. What are the things possibly it may come to your mind? Sleep is considered the dream is considered as a conscious state. So write it down before you hit the bed. What you thought about the events on that day, what are the things you want to plan. So what happens is people do not have wind down time. So all the time, all the things that comes to our mind is only when we close our eye and lie on the bed. So if you are little more daring to take care of your things before sleep, that could be another easy thing that sleep may not be disturbed. Sure.
Wearable devices that you could recommend that can provide any useful data regarding the quality of your sleep?
Okay, so he is asking the quality of the sleep, any device. I do not know at this point if anything existing. There are some crude measures now. It is basing on how much body movement happens. So there are, like, you can wear something on a watch or something like that, or something on your hip or whatever. The same is true with the home sleep study. Like, there are only crude measures based on the body movements. They say, like, whether you are sleeping or not sleeping, but you cannot measure how much deep sleep or REM sleep or whatever you had. The only way at this present time is by EEG. Unless some device is there measuring your brain waves, there is no way to say how much sleep to begin with. Like, you may be like the present day devices available, they only measure your movement. So if you are lying down, not moving, it could interpret it as you are sleeping too. So leave alone the stages of sleep. At this point, we don't even have a very certain authenticative device to say whether we slept or not slept. It's only the body movement. To answer your question more specifically is like we need to have EEG, then we can quantify. Right. The broad range, the science recommends is 5 to 10 hours as the normal sleep. And there is going to be a catch-up phase. If somebody did not sleep, say for example, if you are going on a tour or whatever it is, and if you slept only 5 hours, say for example, if you really need 8 hours of, if you are really tuned to sleep every day 8 hours, and if you slept only 5 or 6 hours for 4 or 5 days, then you're going to have a catch-up phase to compensate that. Like you maybe end up sleeping 10 hours. So that is why people with sleep apnea, they don't have a good quality sleep after they get treated. They have, and I don't know what particular how to answer, like why you are feeling tired if you slept longer. Is that what you are asking? I mean, like you are more. I'm just hypothesizing, like I'm thinking. So say for example, your motivation drive is less, say for example. So it is the mere reflection of how much you still did not fulfill your sleep obligation. So Monday through Friday, you may be sleeping 4 to 6 hours, say for example, and then you are still, Friday night you are sleeping 9 hours, and then you are still feeling tired, because then only your body really realizing why you are tired. So even though you caught up some more sleep, you are feeling tired, but that is not the effect of sleeping longer. I would think it is the effect of the deprivation you accumulated. And because on that day you are not working, your motivation to stay awake is not that great, then you are realizing that tiredness probably. Okay.
Can you talk about the possible relation between snoring and sleep apnea?
Okay, so if somebody snores once in a great while, have alcohol, the upper airway muscles get relaxed and they snore. That is not uncommon. But if somebody snoring on a regular basis, every day, not necessarily all throughout the sleep, If somebody is snoring regular basis, it's more than 90% they have sleep apnea. I would say 95, more than 95% they have sleep apnea. And also snoring is relatively different between sexes. Men's upper airway is more rigid. So if for the same kind of severity, men snore a lot louder. Women's airway is more soft. If a woman snores on a regular basis, that is more likely she has sleep apnea. Same is true with children. If a child snores on a regular basis, or even few days, it is a sleep apnea. We just merely proving it by the objective test. And snoring is not the quintessential for sleep apnea. Like a lot of times, it's called hypopnea, like you are putting extra effort. Even if you are putting extra effort, that is also the same spectrum of sleep apnea. It's in the milder side, but you still can have a lot of milder extra breathing effort throughout the night that could still end up being called obstructive sleep apnea. It is the same one and the same. And not necessarily everybody has to have obesity. How the face is constructed plays a big role in sleep apnea. See, like the airway is in the back of the throat, and that particular small part is shared for the food and airway in the very beginning. And then airway comes in the front and food pathway goes in the back, but it is very small. So if somebody has a small chin, it makes the airway, it's like a pie. So if you have how other organs in the face or other structures in the face are made, it compromises how big the airway is. So if you have a small chin, it is going to be a small airway, because anything comes out this way, it makes the opening bigger. So if it recedes back, it is going to compromise the lumen. If the maxilla, upper jaw is small, narrow, that's going to compromise. If the palate, hard palate is too high, it is going to compromise how big the airway is going to be. The uvula, what we are seeing in the middle hanging out in the back of the throat, if it is too long, it is going to compromise. So not necessarily like obese people are the only one who are at risk. So if you are tired during the daytime, excessively sleepy, better get checked for sleep apnea. See, like the very 5 common things that causes somebody to be excessively tired or sleepy are sleep apnea is the number 1 cause. If I am in India, anemia may be another cause. But sleep apnea, anemia, thyroid is hypothyroid, and depression. These are the very common things that can cause somebody to be tired or sleepy all the time. And coming back to sleep apnea, how important it is it is one of the top 5 risk factors for heart attack or stroke. Like smoking, diabetes, hypertension, sleep apnea, and then lipids, cholesterol. So these are the top 5 risk factors. So sleep apnea's risk factor is not well being in awareness among the society, or not even with the primary doctors. And sleep is being promoted as should be asked as one of the vital signs, like a blood pressure and how much breathing. So sleep and pain are being pushed by the medical community to be added in the vital signs checkup. So how many times you go to your doctor, how many times they ask you, how much do you sleep? How many times you have trouble insomnia? It is not being given importance as it's supposed to be. Go ahead.
On sleep disturbance throughout the night, the pain, and you're always up and down because you can't get comfortable, how does that affect, they say disturbed sleep adds to,
Yeah, okay, so he is asking a question, how pain and sleep are related, basically. So with the better quality of sleep, the pain perception is ameliorated, like reduced, or you don't perceive that much of pain. So when your sleep is disturbed, like it is very common in fibromyalgia patients who are, you touch anywhere, they are painful. So it goes very hand in hand. Fibromyalgia and sleep apnea goes very connected. So once you treat the sleep apnea, they get a better sleep. The fibromyalgia, perception of pain, rheumatoid arthritis, those things get better. I mean, like the condition like arthritis is not getting better, but the perception of pain is getting better. And it also affects the immune system too, so hopefully it could make some changes in the immunity. Many of the conditions are autoimmune, and there are recent articles saying like sleep helps to develop myelin. I'm not saying myelin, myelin is the big basic problem in multiple sclerosis. So I'm not saying sleep helps to change the multiple sclerosis, but the fundamental thing affected in multiple sclerosis is being also affected if people are not getting good quality sleep.
I have a quick question.
Sure.
We're used to thinking with sleep apnea, the only fix is, a CPAP machine or something along those lines. What are your thoughts, and I have no idea, I'm just wondering, about some of the mouth guard or mouth wear to change the shape of that airway?
Okay, so his question is basically, what are the alternative therapies for sleep apnea other than CPAP? Yes, there are alternative therapies available, but CPAP is the gold standard, positive airway pressure. If somebody has a mild sleep apnea, mouth guard, it's not called mouth guard, it is more like an oral device. It can basically, what it does is pull the lower jaw to the front. When the lower jaw is pulled, maybe 1/8 of an inch by the device, it also brings the tongue to the front. Tongue is a very big muscle. What we see outside is only a portion. It is under the surface bigger. So with obesity and stuff, fat accumulates in between the muscle fibers and the tongue become a bigger muscle. When we are awake and staying up, the tongue gravity falls this way. When we lie down, the tongue gravity falls onto the airway. So anything mild devices like oral device could help if somebody has a mild sleep apnea, or you go for tongue reduction surgery. They cannot take away the portion of your tongue. They may be scrapping some portions of the tongue, or they cut the uvula. So any procedures are only scratching the surface. So if you have a very mild sleep apnea, alternative procedures could be a consideration, or they can reduce the severity, but they cannot completely replace the CPAP. Often people fail CPAP because it is something new experience. It is something on the face. They have to get desensitized. They have to train themselves. In my practice, I feel like the failure rate is less than 15%, say for example, but the national standard is like 30% to 40%. If we talk to the patient and if we can explain to them, I feel in my practice like at least 20% I turn them around, start using it. Go ahead. Mm-hmm.
So some of the non-hormonal kinds of sleep aids, have there been studies to show that creates just as much of the restorative sleep as people who fall asleep naturally?
Okay, very good question. Her question is sleep aids. Are sleep aids helpful to have a restorative sleep? The simple answer is no. Again, it is doing something similar effect to alcohol. Like it increases the light sleep, helps you to get some sleep, but most of the sleep aids, they do not give the deep sleep. Some medications can, like the one used in narcolepsy people to consolidate the sleep, that can help, and also gabapentin is supposed to help the deep sleep. That is rare, but by and large, most of the over-the-counter or prescription medications are not helpful to give you the restorative sleep. Go ahead.
What therapies are prescribed for restless leg syndrome?
His question is, what are the therapies available for restless leg syndrome? Restless leg syndrome, to begin with, there are it is a syndrome, it is not a disease. So it could be meaning so many different things. People with neurological conditions can have restless leg syndrome. There are new studies coming up saying microcirculation in the leg itself is being affected. That could also give restless leg syndrome kind of symptoms. Principally, it is iron metabolism and dopamine. The first thing we need to do is to check people's iron level. The iron level may not be as bad as anemia. So if you go to the labs, most of them, they have a normal iron level. They are referring for anemia. That would be up to 20 iron level is considered still normal if you look at for anemia. But for restless leg, we want the ferritin level to be more than 50. So the first thing I do is check the iron level. If the iron is less, then I replace the iron. And then I understand what is going on really. Like if it is, sometimes it could be neuropathy. If it is a neuropathy, we can treat neuropathy symptoms like with the gabapentin or so. That is more effective. Gabapentin used to be the line of treatment for the neuropathy, and dopamine agonist used to be the first line treatment for the RLS. Now, restless leg syndrome, now gabapentin is coming even for people without neuropathy. That is becoming like a first line medication for restless leg syndromes if the iron level is normal.
Can you explain central apnea where your brain stops telling you to breathe?
Yes. His question is, what is central apnea? Central apnea is, we need a drive. Heart, say for example, heart, it works on its own. It's only being modified. The pacemaker, it's in the heart itself. So heart beats, but the brain controls how many times it beats and modulates it. But for breathing, the primary drive starts from brain. It comes to the lungs or the diaphragm to make the movements. So in obstructive sleep apnea, which is a very common kind, the brain's drive to breathing is no problem. The brain keeps sending the signal to the diaphragm to breathe like a 12 or 14 times per minute. But in in the central apnea, the drive from the brain is problem. The brain is not sending signal at least 12 times per minute to keep breathing. That happens more often with people with heart failure or stroke. So if somebody has a very significant central apnea, that is what I will investigate if a person has those problems.
That might be it. One more.
How does gabapentin affect your sleep again? You keep mentioning that medication.
Oh, gabapentin is used for, originally it came in early 90s as a seizure medication. Now, if you look at gabapentin prescription and indication, it is seizure is the last indication anybody uses. It's used for pain, it's used for mood control, it is used for, I don't want to use it as a primary medication for insomnia, but it could be a very good medication for insomnia management too. One of the things is it is not affecting the deep sleep. Most of the sleep aids, either prescription or over-the-counter, they give you longer sleep, but at the cost of taking away the deep sleep. But gabapentin is not affecting the real architecture of the sleep. Go ahead.
On the chart you had for the number of recommended sleep hours for kids, like one of them was like 13 hours or something. Is that like straight hours through the night, or does that also include all their nap time?
I think it is nap times a day.
I'm actually putting that chart up.
Sure.
You went by pretty quick. And again, you guys, of course, we can all watch the video stream.
Go ahead.
In regards to children, you suggest that if they have ADHD or that maybe get them checked for sleep apnea?
Sure. So it is recommended like every child before being diagnosed as ADHD should have a sleep study to rule it. So if the sleep apnea is, treat the sleep apnea. Another important point in case of children's sleep apnea, they don't need to go on to the CPAP and the mask straight away. Once we diagnose sleep apnea, maybe 50% of the children, all that they need is to take the tonsil and adenoid out. So we can send the same child to ENT doctor, and they can take the tonsil and adenoid out, and the airway is cleared. In children, it is more within the lumen, what is like the body is obstructing, causing the sleep apnea. Once we treat that, many of the children improve. We can repeat the sleep study and see 6 weeks later after the tonsillectomy if the breathing got better, and that also increases their cognitive performance.
What about like for epileptic children who take epileptic medications? Does that also contribute to sleep apnea and ADHD?
No, it is not directly contributing. What is happening is anything disturbs, compromises quality or quantity of the sleep, puts somebody at a higher risk for epilepsy, seizure. So the things that can tip off the epilepsy management is the first important thing is sleep, adequate sleep. The quality or quantity if compromised, even if somebody is managed with medication with epilepsy, not having seizures for a while, if they don't have a good sleep for a number of days, for a week, say for example, they are at a higher risk to have a seizure. Or if they have alcohol, that can induce them seizure. If they are in a disco setting, like flashing lights, that can provoke the seizures. So it is like a balance. So when your sleep quality is compromised or quantity is compromised, the same person is at high risk for seizure.
And the medications that are used for seizures, do those help deep sleep in children, or do they compromise it?
Okay, her question is the medications used in seizures, do they help deep sleep? Other than the gabapentin, there are some medications that can reduce the quality or quantity of sleep, but there is not a prevalent data how much deep sleep is being compromised. Generally, seizure medications are drowsy as a side effect. So generally that would help the person to sleep, but we don't have a data, or I don't know how much it is being helpful in the deep sleep or light sleep. Go ahead. Right. Another big topic, PTSD and sleep. So her question is, what is the relationship of PTSD and sleep? Yes, that is another example how the brain processes our memory and the emotions during sleep. That is why people replay the same scenes what they traumatized them to begin with. Sure, right. So what is happening is whatever the reason, the sleep, it is being tied how many times somebody waking up. Whenever we wake up from sleep, we also disrupting the breathing rhythm. So for whatever reason, even if somebody is not having sleep apnea, if they, for insomnia or PTSD reason, in the beginning, if they start to wake up so many few minutes every time, that ends up disrupting the nice, peaceful breathing. So, and that end up being counterproductive. And the breathing becomes being disrupted, then again, even without the real cause to disrupt the breathing, the disrupted breathing become a habit. And that kind of in turn flares up the other waking up reasons like a PTSD. So in the beginning, PTSD, like a multiple awakenings, disrupts the breathing, but later on, the breathing interruption end up making the PTSD to flare up in the vice versa mode.
So
Yes, true. Correct. Go ahead.
So what signs or symptoms can we or spouses look for as kind of warning signs that would you would recommend then seeking consultation or sleep study or some sort of treatment? Is there anything that we can watch for?
Right. What are the signs of sleep disorder? That question he is asking. If somebody is sleepy or tired all the time, that is a very important sign. During the daytime, or somebody is not able to concentrate or focus, another important sign. And the nighttime is not able to maintain sleep. If there is a trouble falling asleep or sleep, insomnia is considered either one of the two, trouble falling asleep or not maintaining the sleep. So if you have trouble falling asleep more than 30 minutes or not able to continue your sleep within 30 minutes of awakening in the middle of the night, then it could be an insomnia. You can seek help. Or if there are some excessive body movements, leg movements keep kicking, and that is disturbing the sleep onset or disturbing the spouse, that can be now and more, insomnia is not just only considered as a sleep problem. It is considered to be a hyperarousal 24/7. So, I mean, the scientific community do not want to say insomnia and anxiety and depression are one package. It is, when somebody having insomnia for more than 3 months, there is a very high likelihood they have a depression or anxiety along the way. And the vice versa is true. Many patients with depression and anxiety, they don't have a good sleep. The hyperarousal of 24 hours. It is not just the lack of sleep that need to be addressed.
I'm going to see that when I take gabapentin for RLS. I recently saw a neurologist who prescribed Lyrica, which he thought was more effective. Do you have any experience with that? Lyrica versus gabapentin.
He's asking a question, gabapentin versus Lyrica. I just don't want to address any personal issues. I don't want to be a consultant, but I can just address like between Lyrica and gabapentin. Lyrica is a more refined version of gabapentin. Some side effect of gabapentin may not be there with Lyrica. If somebody does not have significant side effect, and if they can tolerate, as far as the effectiveness of both medication, I would say effectiveness is pretty much the same. Controlling restless leg or pain or whatever it is. If somebody has a lot of side effect with gabapentin, they like the effect, then Lyrica may be a better choice, but it is much more expensive.